So as we have seen in the last videos, the common reasons, symptoms and the causes of shoulder pain, we'll go into the details of the treatment part. So if you have these problems, you visit a shoulder specialist. What we usually do for you is, first investigation we do is X-rays of the shoulder. Second investigation which we do is MRI of the shoulder if necessary, and in very limited number of patients we do a CT scan. After doing all these investigations, we head on to blood test. What are more important blood tests out of the panel of blood test is sugar, blood sugar levels, the HbA1c, which is 3 months average of the sugar, and we do vitamin D and vitamin B12 levels. According to the investigations, we come to a diagnosis, and then we offer you treatments, various treatments in the form of non-steroidal anti-inflammatory drugs, or commonly called as painkillers. We give you heating as fomentation for local application, as well as some local application gels or oils. We ask you to take a rest for few days to few weeks. Activity modification. This is followed by starting you on a physiotherapy protocol, which will involve using certain machines initially, then moving on to basic exercises and eventually advanced exercises. If there is no recovery or there is no improvement by taking the medicines and adequate physiotherapy, then we offer you more advanced treatments in the form of USG guided or sonography guided injections, which can be PRP or platelet rich plasma injections. It can be steroid injections, or we can offer you surgery in the form of keyhole arthroscopic surgery. Post-surgery rehab protocol is equally important. Doing the surgery is the first part, but 50% of the recovery will depend on the rehab protocol, which is a supervised physiotherapy protocol involving getting the movement completely back and getting the strength completely back. For any given shoulder problem, out of all the shoulder problems we have mentioned, average time taken for a recovery is 6 to 9 months, depending on how severe is the problem and depending on how well you follow up with the physiotherapist and the compliance henceforth.